Hello, everyone. I'm so excited to be here with you all at Lancaster Mennonite High School for your job and career fair day. I am a graduate of Lancaster Mennonite as well, so I'm so excited to be back here with all of you and discussing exciting things in nursing and being a professional. So, to start off, what are some things that you would consider or think of when you think about being a professional? So, some things I got from the class are time management, being respectful, good organization skills, coming to work well groomed, so coming in nice, clean clothing, not smelling of anything like smoke or extra strong scents or anything like that. So, yes, those are all great things of being a professional. So I do have a couple handouts for you guys to look at. The first one is going to be this little brochure pamphlet here. This is going to be a majority of what we're going to be talking about today. So we'll go through this kind of step by step and talk a little bit more about nursing. And then I also have two other handouts for you that I will go over as well. So pretty much the first thing on the front of the pamphlet we're going to talk about is let's talk nursing. So the main thing is why choose nursing? Why do you want to be a nurse? Why would you think about going into this field? So just to start off, nursing, the profession of nursing is challenging, interesting, and rewarding all at the same time. Nurses are the heart and soul of healthcare who make a difference every day in patient lives. There are many professional development opportunities and a variety of work environments. And that is very true. There are all kinds of fields you can go into nursing. There is pediatrics, geriatrics, you can work in the OR, you can work in home care, you can work in a hospital setting, you can work with cancer patients, all kinds of opportunities you can do. There are so many different career paths you can take once you become a nurse. So that's going to bring me to the first point is what do nurses do? Some of the main things that we do as a nurse are going to be patient assessments. So assessing the patient, seeing about what's going on with them, as well as monitoring their overall status, depending on what they're being seen for or what's going on with them individually. Medication administration, that is a big one. And that would be including IVs, immunizations, and oral medications as well. Another thing is to monitor patient recovery and progress, and client education, other treatments, and wound care. So those are all things that fall into our category of nursing and what we can do on a daily basis. Which also brings me to another point is we use different skills depending on the clinical setting that we're in. So if we are working in a hospital, we might be having more patients at one time, as well as doing more acute care type things. So administering IVs, giving blood, all those kind of things. And depending on which floor specifically will also factor into what you're giving. Certain medications, certain antibiotics, things like that will just kind of factor in what specific patient population that you're working with. So for example, if you're working on the oncology floor, you might be working with chemotherapy, radiation, things like that on a daily basis. And another thing is to provide holistic care. So that's a big thing in nursing that we are working towards, and that is incorporating all aspects of care as a complete person. So we're not just looking at the physical medical needs of what's going on with our patient. We want to incorporate the physical aspect, but also psychologically, socially, and spiritually. All of those things go into holistic care, and all of those things complete the patient as a whole. The next important point we're going to talk about is education. So education, I know everyone is ready to be graduates of high school and thinking about their next steps. So education, there's a couple different routes you can take. If you would like to go for more a shortened program, there is an LPN option available, and that stands for Licensed Practical Nurse. Those programs are vocational programs, and they're about 12 to 18 months, depending if you want to do full-time or part-time, days or evenings. Things like that will affect the time, but that's about the time range that you would go. And then as an LPN, you're going to be doing monitoring client findings as input to the registered nurse's ongoing assessment. And you can also do medication administrations, treatments, wound care, things like that as a nurse, as an LPN. And the next one option would be a registered nurse. So that one is up here. And a registered nurse, it is a little bit more of a formal program that you're going to go through. They typically are about 2 to 3 years for an associate's program, and depending on if you want to do days or evening weekend program. A lot of schools offer both tracks that you can do whatever works for you, and both options are great. The other option is a 4-year BSN, Bachelor of Science in Nursing. So some colleges actually have that all lump sum into one. So you'll do the 4 years all together. After that 4 years, you'll be an RN and have your BSN in nursing. And as an RN, you're going to be doing the supervision of the LPN. So you're going to be overseeing a lot of things with the LPN, is also collaborating with the LPNs and unlicensed personnel. So they're going to be your CNAs and your patient care assistants. You're going to be as an RN, you're going to be using more critical thinking skills that are specific. And you're also, as an RN, you're going to be trained for more specific skills that LPNs, it's out of their scope of practice. So some of those specific skills, they do vary by state. Here in Pennsylvania, some big ones are IVs, specifically with IV push medications. LPNs are not allowed to administer IV pushes. The RN is only allowed to do that. And blood administration. Only RNs are allowed to administer blood here in the state of Pennsylvania. So depending on the state, there is some limitations and what's in the scope of practice that you can do depending on your license. And after graduation, after graduation from accredited program, you will be eligible to take the state board exam, which is NCLEX. And that's where you'll get your nursing licensure. So with education, it's a lot to think about. Personally, my route, right after graduation of Lancaster Mennonite after high school, I went into the vocational program to become an LPN. So there I gained a lot of my foundational knowledge. I learned so much just being fresh out of high school, just getting into wanting to get into a career, not knowing for sure if this would be the right path for me, and I really liked it. So I did that program. I finished it in a year, and I got my first job in pediatrics. I loved it. And I've been in peds for 6 years. So after being an LPN for 6 years, I went back and decided to be an RN. I wanted more growth. I wanted more opportunities. So I went to Pennsylvania College of Health Sciences, formerly known as Lancaster General's College of Nursing, and that's where I became an RN. And I did the 3-year RN ASN program. So I have an associate's, and now I'm working towards my bachelor's in nursing. So there's all different routes you can go. The field of nursing is so broad, and there's so many different paths you can take. I've been in class with younger students all the way up to older students in their 50s or 60s wanting to do this as a second career, or just pretty much non-traditional students. So it's a great field. There's so many different opportunities you can do as far as getting your education. And they tailor career paths or education paths to how you want to move forward with this career. The next thing I'm going to talk about is continuing education. I know we just talked about education in general and how long it takes to kind of go through that process just to become a nurse. But in the medical field and the field of nursing specifically, you're going to always deal with continuing education. So this is something that applies for our licensure specifically, that the state requires us for renewing our nursing license, and they are going to be dependent on the state of how many hours or credits you need. For the state of Pennsylvania, it requires registered nurses to have 30 hours of board-approved continuing education every 2 years with your license renewal. So things like that, you can do all kinds of continuing education activities, and they're actually fun. You can go to conferences, all kinds of things, and just learn about the ongoing changing of our medical field. It's very, very cool. And many nurses continue their education to obtain further degrees. So some of that would be Master's in Science in Nursing, which would be a MSN, Certified Registered Nurse Practitioners. So that's even higher level. Advanced Practice Nursing, Critical Care Certification, CCRN. So there's all kinds of routes depending on where you want to work in nursing. You can always use that level up and go for higher education, even specifically in the area you want to work in. The next thing we're going to talk about is the understanding the use of the ANA code for nurses. So that's here on this area on the third page. And what the ANA stands for is the American Nurses Association. So that is a professional organization that advances and protects the profession of nursing. The ANA outlines the vision, values, goals, and objectives for improving healthcare and advancing the nursing profession to improve health for all. The ANA standards of clinical nursing practice include standards of patient care and standards for professional performance. So that's something that you're going to resort back to a lot with the American Nurses Association. The next thing I'm going to talk about is professional organization involvement. So there are many ways to become involved in the organization that you work for. A great example is being a part of a committee. So this allows you as the nurse to give input and advocate for nurses, yourself and other nurses as well, staff, patients on various topics. So things like that, especially in the facility, if you want to be a part of making changes or just advocating for staff and patients to make changes or improve things is a great way to become involved in the organization that you work for. So the next topic that we're going to move on to is going to be communication and publication. That's on the last page here of your pamphlet. And communication is a very important part of nursing. Nurses use proper and effective communication to collaborate with other members of the healthcare team to provide safe and effective care. So communication is a very, very big part. I cannot stress that enough, as well as collaboration. So when you're taking care of patients, patient care is the number one goal, and being able to communicate with your fellow nurses, staff, your patient care assistants, your physicians, being able to communicate things that you need or your thoughts on their care, to be able to get them safe and effective care is so important. Sometimes it's noticing something is going on, doing an assessment, and calling the doctor, hey, I think something's going on here, this is my recommendation. Or having a fellow nurse, you're having a hard time, you've got a patient that's in isolation, it's taking you a little bit longer, your next patient's hitting their call bell for medications, and it might just be communicating with a coworker, hey, do you think you could check in on this patient while I'm tied up here? So that's a big part of being a team and just communicating in general with all of your staff. Autonomy and self-regulation is the next area I'm going to discuss. So critical thinking is a large and very important component of nursing when providing patient care. So autonomy and self-regulation allows nurses to have authority to make decisions and the freedom to act in accordance of their personal knowledge. So that is very pertinent to when we're taking care of patients. So if we notice something's going on, we're going to need to use our critical thinking skills to make that appropriate decision for patient care and use our nursing knowledge to be able to effectively and safely care for that patient. And that pretty much allows us to make those decisions within reason and within our scope to be able to provide that care for the patient. Another aspect of our nursing profession is going to be community service. So that one here is at the bottom of the last page here. And one of the most wonderful aspects of nursing is caring for others. I truly believe that, and that's one of the things that I love the most about this field. The field of nursing opens the door for many opportunities to use your nursing knowledge and skills to help members of your local community. This also is a great way to educate and provide screenings to members of our community who need it the most. So examples of this are going to be, you can take blood pressure readings, so that's a great one, at community service centers. So being able to go in, take their blood pressures, write the numbers down for them is a great thing to do. Another thing is giving presentations, education. About another example would be nutrition and diet. That's a great thing. Our older population especially is about maintaining their health and ways to improve their nutrition and things like that. Healthy meal options. Just those simple education techniques are great for people to learn from. So multiple community service options out there. So that's just, two of things that I've personally done with the blood pressure screenings and the nutrition education, and they were great. We had great outcomes, and the patients and clients where we went really appreciated all of our time that we had spent there with them. And the last part I'm going to talk about is going to be the nursing theory and knowledge. So that's going to be on the back part of your pamphlet here. And pretty much what that is nursing theory is also accommodated by clinical practice. So it's going to be intertwined with what we're learning in classroom setting as well as how we are carrying that out in a clinical setting. So clinical is often intertwined with nursing theory to allow students to learn about specific concepts and then incorporate them into practice. So a lot of hands-on learning with that. You're going to learn about things, textbook versions, quote-unquote, of things, and then you're going to go out in the field and you're going to see these things firsthand and being able to take care of patients with these things that you learn about in school. So nursing theory includes basic to complex concepts of medical diagnoses, treatment, and care. And concepts include critical care, so that's going to be your ICU, specific trauma, things like that, med-surg, community health, psychiatric and mental health, and OB/GYN and pediatrics. So those are just kind of some of the concepts that you will go over, and you'll have the theory, and then you're also incorporate that into the clinical setting along with that. And it's really a great experience to get that hands-on experience once you learn about that stuff in theory, to be able to hands-on experience that. One example that I can give from personal experience is my psych rotations. We did psych and mental health in theory, and then we also had a clinical rotation at a facility in a psych unit. And, hearing about the patients, specifically our schizophrenic patients, with delusions and hallucinations, seeing that or learning about that in class and then actually seeing the patients with that just brought the whole picture together. It's one thing to read about it and learn about it, but then when you're actually sitting face to face talking about the patient, having these hallucinations or delusions, actually believing what they are seeing is very, very fascinating. And just being able to bring that whole picture together is a great learning experience. So that is what I have here for you in this pamphlet, and you're all welcome to take this home with you. So there's some great, information along this that we discussed, front and back here. So you guys can all take that with you as we had covered everything in that pamphlet. And I do have some other handouts for you to take as well. This one is going to be a little survey here. So it pretty much goes over some basic concepts and some personality traits, pretty much just about yourself and what you think about nursing. It's about, are you thinking about pursuing nursing? And it just asks you some yes or no questions. And depending on how you answer that, nursing might be a field that you want to explore or think about. And some examples of that on here, I'll just read you some of the questions. Am I good with people? Can I handle stressful situations? Do I enjoy helping others? Do I enjoy continuing my education? So those are just a few of the questions that you can answer on here, and that is also for you to take with you. And the last thing that I am going to give you is this paper here. And this is going to be an opportunity for you to shadow. So shadowing is a great experience figuring out if this is a field that you're going to be interested in going into. So what you'll do is just put your name at the top here, phone number, and then the type of nursing you're interested in. So that's going to be, do you think you want to work with kids? Do you think you want to work in long-term care with our older adult population? Do you think you want to work with cancer patients? Do you think you maybe want to work in home health? So those are some great options you can list here of what you think you might be interested in if you're thinking about doing nursing, and then just give them back to me at the end, and I can see what I can do as far as reaching out to some of my fellow nurses about getting some shadow opportunities in to get you guys exposed in the field of nursing. So that is all that I have today, and it was wonderful coming into the classroom and being able to talk to you about being a professional in nursing. If you have any other questions, feel free to see me at the end of the day. Thanks.